And this is what we know. We know that reducing the instances where people are in close proximity to others helps to contain infections. We know that the coronavirus spreads at funerals, in office meetings, at parties, at family occasions, and restaurants and taverns. That is why at adjusted level 4, we have had to prohibit religious, social, and political gatherings. We also know that as more people move, the virus moves with them and spreads. Because of the relatively high numbers in Gauteng 2 weeks ago, we limited movement in and out of the province to slow the spread of the virus to other parts of the country. We know that curfews reduce movement and limit the late night social gatherings that increase the potential for transmission. We know that restrictions on alcohol sales reduce the number of admissions at hospitals and emergency rooms with alcohol-related trauma such as motor vehicle accidents and interpersonal violence. Reducing alcohol harm frees up much needed capacity in our health facilities to deal with COVID-19 cases. Alcohol abuse is also associated with gatherings and non-adherence to public health regulations. At the same time, we know and recognize the vital contribution of the alcohol industry to our economy. Ultimately, the most important measures to limit transmissions are those that are within our individual control. Because the Delta variant is more transmissible, we need to be far more diligent in following the basic precautions with which we are all familiar with. As we implement measures to limit the number of infections, we are acting to protect as many people as possible through vaccination. Our national vaccination program is expanding at a reasonably rapid pace. To date, over 4.2 million people in our country have received a vaccine dose, with 1 million of these having been done over the past 7 weekdays.